Our keynote speaker this morning is Michael West. He is the head of thought leadership at King's Fund. He's a fellow of the British Psychological Society, the American Psychological Association, and the International Association of Applied, you can guess the next word, Psychologists, and also the British Academy of Management and the Academy of Social Sciences. The focus of his research over the last 30 years has been culture and leadership in organisations and teams, and organisational innovation and effectiveness, particularly in the health services. He provides regular policy advice to many National Health Service and international healthcare organisations. Now, unfortunately, Michael comes to us via video today as his travel plans had to change due to events beyond his control. After Michael's address, we'll go straight into, without me introducing him, Tina Gianney, who will be providing a patient's perspective of her experience with the New South Wales health system. But firstly, please welcome, do you applaud if he can't hear you? It's really up to you. He'll never know. But here comes the video of Michael West. Yes.
Hello, it's a pleasure to be a part of the New South Wales Health Innovation Symposium. I'd like to use this privilege and this opportunity to address two questions. How can we respond to the huge challenges which face us in delivering health and care to people in our communities? And what can we individually do that will make a difference? Our healthcare systems have been set up to ensure that we provide high quality care for everybody in our communities. Our healthcare systems express a core societal value of compassion. And all of you working in the New South Wales system have made a decision to dedicate an enormous part of your precious, unique lives to caring for your fellow human being. So you too embody a core work value of compassion. For me, compassion is the healthcare assistant I saw who stayed an hour after her shift had ended, holding the hand of an elderly lady who was in distress and talking to her lovingly and caringly until she was calm again. It was the primary care physician who told me that she'd danced in her surgery that day with an elderly, lonely man when she discovered they had a shared interest in dancing. Beautiful. And I'm sure you see and model examples of some compassionate care in your work lives frequently. Compassion, I think, has four elements. If someone is in distress, first of all, what we have to do is be present with them, pay attention to them, be here and now. To use Nancy Kline's wonderful phrase, listen with fascination to them. Second, we have to understand what the causes of their distress are, ideally through a dialogue with them. And third, we have to empathise, we have to feel for them. And that gives us the motivation to take the fourth step, which is helping or serving them, to help them deal with that distress or reduce it. And when patients experience compassionate care, as we'll hear shortly from Tina Gianney in the next presentation, they're much more satisfied and very appreciative. It has powerful impacts. And that in turn affects the well-being and the commitment of healthcare staff. So we get virtuous cycles of compassion. So how are we to create cultures of compassion within our healthcare organisations? Well, every interaction by every one of us every day nurtures the culture, shapes the culture of our organisations. But leaders play a particularly powerful role. What leaders pay attention to, what they monitor, what they talk about, what they model in their behaviour, what they reward, tells us what they value. And that shapes the culture very powerfully. So in order to have compassionate cultures, we need leaders who embody compassion in their leadership. That means leaders who pay attention to their staff, who listen with fascination to them. Leaders who seek to understand the challenges that their staff face, ideally through a dialogue, so it's a shared and more accurate understanding. Leaders who empathise with staff in facing the challenges that they face in their work lives. And that gives them the motivation to serve or to help their staff. After all, that's what leadership is about, is serving or helping those we lead to enable them to do the job to the very best of their ability, to provide high quality, continually improving and compassionate care. So compassionate leadership is central. We also know what the key cultural characteristics are of organisations that deliver high quality care in healthcare. And that tells us what our leaders need to focus on in their daily work lives. And there are 5 key areas. The first is a vision, an inspiring vision, and that's about leaders therefore focusing on high quality care, the delivery of high quality care, continually improving care and compassionate care. And that's not just about having a bunch of words on a website, but it's about what leaders pay attention to, talk about, model, reward every day. And second is the importance of translating those visions, those inspiring strategic narratives, into clear priorities and objectives, a limited number for every team, 5 or 6 clear, agreed, challenging objectives, and providing feedback to teams on how well they're doing in achieving those objectives on a very regular basis. Third is ensuring that we have enlightened people management, supportive, positive, optimistic leadership that creates a sense of psychological safety for people within our healthcare organisations. Fourth is encouraging learning, continuous improvement and innovation, the central topic of this conference. And fifth is developing, nurturing, enthusiastic team working, cross-boundary working and cooperation. But what we also see in studying high-performing healthcare organisations around the world is that leadership must be collective. The worst form of leadership for high-performing healthcare organisations is dominant, hierarchical, top-down, bureaucratic, rigid, controlling leadership. What we've learned is that collective leadership is vital, where everybody feels that they have leadership responsibility in the organisation, to speak up when they see a need for change, where there's shared rather than dominant directive leadership in teams, where leaders work interdependently across boundaries, prioritising patient care overall, not just their individual areas of responsibility. And particularly importantly, collective leadership is about consistent leadership styles across the organisation, characterised by authenticity, leaders who are genuine in their interactions, leaders who are open and honest, leaders who are curious to learn about how they can lead better, asking those they lead, how can I support you more effectively? What should I do more of? What should I do less of? Leaders who are appreciative, who acknowledge people's contributions on a really regular basis, and leaders, of course, who are compassionate. And when we have that kind of leadership, we release the innovation, the creativity of the people within our organisations. We create the conditions for innovation and new and improved ways of doing things. But compassionate leadership, I think, is at the core of our attempts to create cultures that deliver high quality, continuously improving and compassionate care. If all of the people who come to work within our healthcare organisations in New South Wales every day experience compassionate leadership, compassionate interactions, compassionate cultures, they take that compassion back out with them into their families and their communities. And if all of the people who are served by the New South Wales health system receive compassionate care, they also take that compassion back out with them to their families and communities. And we begin to have really positive effects throughout our whole communities, our whole societies. And that begins with us as leaders, modelling compassion. But in order to model that compassion, to have the resilience and capability to be compassionate, we first have to practice self-compassion. That means us as leaders paying attention to ourselves, understanding the challenges that we face within our lives and within our work, caring for ourselves, empathising with ourselves, and taking intelligent action to help ourselves in order that we can be who we can be and stay close to the core values that give our lives meaning, like compassion, and enable us to have closer and deeper and more authentic connections with all we interact with. Thank you, and have a wonderful conference.